dose, you'll need a booster dose. In our population, the majority of doses, second doses would have been given out in July, August, September. So second dosing will be required in December, February, January, and February. Next slide. So peer-reviewed studies from the US, Qatar, and Israel show that immunity falls over time. And that's the time that I would have gone through in terms of 6 months. Different countries will use slightly different benchmarks in terms of how they're going to administer the booster doses. 6 months, for example, for US after your second dose, Israel, 5 months after your second dose. Next slide. The emergence of new variants of concern further emphasizes the importance of getting all your recommended vaccine doses, including a booster, when it is made available to you. Next slide. So again, we go back to our basics. At this point in the pandemic in Trinidad and Tobago, we have to go back to our basics. Wearing our mask is probably our best means of protection at this point in time. We may wear it at any time that you leave your house. Of course, wear it appropriately, covering your nose, mouth, and chin. Watch your distance as best as you can. Wash your hands as frequently as possible when you think that they may be contaminated by touching surfaces. And if you could go to my last slide, we really need to continue the 3Ws as an urgent matter. We see the number of cases yesterday was just under 1,000. In order to get that number down, we need the majority of us to abide by the public health guidelines as best as we can and vaccinate as soon as we could possibly can to protect yourself from infection and reinfection, to protect others, including the ones you love the most, to prevent the formation of new COVID-19 variants, and to break the chain of transmission. Be socially responsible, and I thank you, Ms. Alcantara, for the few minutes this morning.
Thank you very much, CMO, for that update on variants of concern. And now we go to the Honorable Terence Dayal Singh, Minister of Health, for his presentation.
Thank you, Candice, and good morning to the Chief Medical Officer. Good morning to the ladies and gentlemen of the media, and also especially members of the public who are listening and viewing. Wherever you are, good morning to you. So let me bring you up to date with our current vaccination program, where we at. As of close of play last night, first dose, 648,320 persons. Yes, that's the slide there. 648,320 persons, which represents about 46.3% of the population. Second dose, so those on the way to being fully vaccinated, and really congratulations to you. I really want to thank all the persons who are taking advantage of the vaccination program. You are really helping us and helping healthcare workers in this battle against vaccination by doing the right thing. 647,907, which is roughly about 46.3% of the population. And for those who have taken the additional primary dose to date, since we launched the program maybe about 2.5 weeks ago, 32,231. So we are currently doing about 2,000 doses a day of additional primary doses. So, I really want to congratulate all those persons who are seeing the light to take the vaccines. You are being very responsible. You are doing the right thing. You are following the science. And you are helping not to overburden our public healthcare system. And I really congratulate you and thank you. And speaking to healthcare workers during the course of the week and up to this morning, they appreciate your efforts to be vaccinated. It means they have so many less persons to care for. And on their behalf, I want to put out the plea to the other couple 100,000 persons. Please make a Christmas decision to get vaccinated so we can decrease the pressure on them. They are under pressure. They are our heroes and scrubs, from the porters, the patient care assistants, the nurses, the doctors, the lab techs. They are tired, but they come out every morning re-energized to provide the best possible level of care to you. I want to go back to a basic statistic that we started to share with the population, and I remember distinctly on October the 7th, 2020, at the first press conference the Honorable Prime Minister had in Tobago, where both Dr. Parasham and I were there. And at that press conference, I started to give the country a picture of what was happening globally. And it was said at that time that there were 7 countries at that time with over 1 million cases of COVID-19. 7 countries. To date, a year and 1 month later, there are now 40 countries around the world with 1 million cases and over. And waiting to join them are 5 other countries with over 900,000 cases. I used to give these global updates, and I think it's useful to restart that. Why? Because we have to constantly be reminded that this global pandemic is nowhere near over. So, in 1 year and 1 month, we moved from 7 countries with 1 million cases to 40 countries. And there are 5 more waiting in the wings to join that club of countries with over 1 million cases. What is the global picture as far as COVID-19 is concerned? Again, I used to remember that we would predict 100 million cases, 200 million cases. There are now 265,410,585 COVID cases around the world. 265,410,585. And the other startling statistic to which we contribute over 2,000 cases are deaths. 5,261,961. Ladies and gentlemen of Trinidad and Tobago, as your Minister of Health, we have to keep reminding ourselves that this global pandemic is not over. It is not over. What the virus is doing, and if you look at the international news, especially from reliable sources and, and the global health experts, in any area of the world where you have low rates of vaccination, it gives the virus an opportunity to be transmitted from person to person. It seeks out the susceptible persons, mainly those who are unvaccinated, and even some of those who are vaccinated who have comorbidities, who are susceptible. And this gives the virus an opportunity to replicate. The more it replicates, the more errors in replications, which give rise to mutations. This is how we got the alpha, the beta, the delta, the omicron, and it's only a matter of time before we get another variant, possibly called rho. Then you go to sigma, then you go to the other letters in the Greek alphabet, because the virus is not finished with us, but we think that we are finished with it. So the basic message I want to leave Trinidad and Tobago with this morning is that the global pandemic is still at large. The virus is seeking out the susceptible. And when that happens in areas with low vaccination rates, it gives rise to increased transmission, increased mutations, as we have seen with Delta earlier this year and now Omicron. So the basic message to leave you with is one of vigilance. We need to be extremely, extremely vigilant as a country at both the country level, the societal level, the village level, the street level, but most importantly, at the personal level. Personally, we have to continue with the tried and proven methods of managing this thing, which the CMO just spoke about, the social distancing, the masking is important now, um, and now vaccinations. One of the best way to slow down and put a damper on this now global surge is vaccination. we're at 46.3%. That is sort of halfway decent, but we could have done so much better. The vaccines are there, it's free, it's available, it's easy. Just make the decision today to give yourself a Christmas present of life by being vaccinated. Thank you very much, Candice.
Thank you very much, Minister Dayal Singh. And in the usual fashion, we go now into the question and answer segment. We ask representatives from our media houses, please state your name and the name of the media house that you represent before you pose no more than two brief questions. Again, please make your questions brief. If we are able to, we will come back to you. And we start this morning with questions from AZP News, please.
Good morning, Private Harry, azpnews.com. My first question is for the CMO, and the second one is for the minister. CMO, good morning. I wanted to find out one of the major arguments that the anti-vaxxers use is that since we started our vaccination program in April, cases of COVID-19 increased and also death increased. In other words, they are blaming the vaccination for that. I just wanted to get your response. And secondly, Minister, I just wanted to, are you hearing me?
Yes, I am, Prior. Yes.
Minister, I wanted to get your take on the 16,000 AC vaccines that we got from St. Vincent, and now it appears that that we have to pay for those. I just wanted to get what is the situation with that, and have we paid for it? Thank you.
Well, yeah, thank you, Parent. So generally speaking, as you know, before vaccines even came to the country, we would have had a surge in cases last year, 2020, when we had a surge in cases in August and September. Subsequent to that, in March or thereabouts, we would have had the entry of the P1 variant, which we said to everyone is twice as transmissible as we would have seen for the original Wuhan lineage. So we would have expected to see an increase in the number of cases during that time, which we did. So coming March, April, May, thereabouts, where our vaccination rate, if you remember right, was less than 0.1% of the population. So basically an unvaccinated population, yet we continue to see a spike. Had nothing to do with vaccines. Vaccines have been proven all over the world to provide protection against infection, to provide protection against severe disease, provide protection against deaths to a significant amount. The temporal relationship between the rise in cases and the increase in vaccine is exactly just that. It coincides with an increase in the different types of strain. We had P1 coming in, and then of course we had Delta coming in later, which is much more transmissible. So it coincides with that increased movements of people as well. And then of course we use the public health guidance as a guide to slow the spread as well. So it is an interplay with all those things, but certainly the vaccines, all it is a temporal relationship, but have no link to increased spread of COVID-19 at this point.
Thank you. And I just want to back up what the CMO is saying and to further expand on the answer to the question prior had about vaccines and deaths and the anti-vaxxers. You see this headline in Thursday's Guardian was an absolutely brilliant headline. This tells you all you need to know. Vaccines saved our lives. And this is what vaccines do. And when you read the body of the article, and I really want to congratulate Guardian Media for this. It was a very responsible piece of journalism. But when you read the article inside, Jogi said she received her second dose of Sinopharm in the second week of August. The other person, I believe, did not name the brand, but that is not the point. Because we keep saying on this platform, when we ask about which brand of vaccine does this, which brand does that, we continually say, take whichever vaccine is in front of you. So vaccinations saved these two lives of these two young ladies. This is all the evidence we need to encourage those who are on the fence to get vaccinated. So I just want to, and I'll be keeping this with me. I walk around with this now because this is by far much more effective than anything we can do. We can say this is actual testimony from Danielle Suku and Myra Jogi. And these two young ladies are to be congratulated for coming out in the public because very often we ask people to share their experiences with us, and some are camera shy. But these two young ladies have done the public a great service. Um, on the issue of St. Vincent Prior, I think the three main players in this subject have spoken. The Honorable Ralph Gonzalez, Prime Minister of St. Vincent, the Honorable Dr. Keith Rowley has spoken, and the Honorable Dr. Amory Brown, who is the Minister of Foreign and CARICOM Affairs, have spoken. And those are the three main actors in this particular issue, and there's nothing more constructive or further that I could add at this point in time. My job is to vaccinate people at this point in time. Thank you very much.
Thank you very much, Minister. We go to TTT, please.
Good morning, Terry Ann Brown Campbell from TTT News. My first question is to Dr. Parasram. After 20 months of this COVID-19 pandemic, I want to ask Dr. Parasram, how is he doing? My second question is to the Minister of Health. After 20 months of this pandemic, is there any plan in place to provide relief for our healthcare professionals, nurses, and other staff? Because just as you said, we are in our third wave and the virus is not done with us. Thank you.
I noticed it didn't ask how I am doing. Well, that's all right.
You want to go first? Nancy?
No, you go ahead.
All right. So on a personal level, we all, is something that is going on for almost 2 years now. I think it would have started December of 2019. Most of us somewhere in the middle of 2020 and seeing vaccines come into the play would have expected that it would have been much less. When Minister went through the WHO daily tally in terms of number of cases and number of deaths, we all thought it would have been much less by now. So on a personal level, we all, as healthcare workers, we continue to do our duty. We go day to day as best as we can. I think my job has been as well to keep the population updated in terms of the new variants of concern, the new trends, characteristics of disease, and what we can do in Trinidad and Tobago as best as we can to survive and to control the virus within our borders. So we continue to go day on day, and I could speak for all the healthcare workers that we have been going at it for quite a long time now, and we need the support more than ever of the country to stand behind us and use your public health measures as best as you can now. I think we got through this before. Without vaccines, using our public health measures, we were able to control this disease. Yes, we are dealing with more transmissible variants at this point in time, but we can once again stand in solidarity as a nation, get the number of cases down and under control by using the simple public health measures and not throwing it to the wayside. And of course, vaccinating, which is we are in a position to offer vaccines to everyone. And we really want people to come forward and get your vaccines as quickly as you can, so our country can, at least in Trinidad and Tobago, we can get to a place where we are as normal as we can be in the middle of a pandemic. Thanks for asking the question.
Thanks. So, one of my new jobs as Minister of Health, because you are right, after 20 months, as Minister of Health, I have to be concerned about the welfare of my staff, like the CMO, the executive staff, but I am also deeply concerned about our healthcare workers. So I will give you a very detailed response on what we are driving from the Office of the Minister of Health in talking to the RHAs, in talking to the GMs of nursing, the directors of health. So at the South, because what we do at each RHA will vary depending on their needs and the pressures they are under. So at the Southwest RHA, because I have been tracking this, They have done recent additional staff hires, particular patient care assistants, to take away some of the burden from the enrolled nursing assistants and registered nurses. They have employed mental health teleconsults, one-on-one counseling, sensitization session with frontline staff and mass casualty management, psychological first aid, and maintaining mental health being. They have been maintaining staff availing themselves of leave provisions for now, which is important, as worked out amongst departments for Christmas. They are maintaining their Christmas shopping days to give them some sense of normalcy. At the Northwest RHA, 12-hour shifts facilitate additional days off. Sometimes they get 3 to 4 consecutive days off. Again, proactive psychological and psychiatric intervention, detoxification sessions, direct personal interventions as necessary. Transportation for nursing staff available on request to ease their inconvenience. Lunch and food at COVID institutions, sporadic festival and special other types of events just to give them that boost. However, that cannot take away from the load. It's good therapy, but what they need is for the public to not get infected. At the Northwest RHA, hiring of some additional staff, especially doctors and PCAs, patient care persons, rotating staff in and out of high intensity areas where possible. So they are not operating in that pressure cooker situation, eternally, but notice the words, where possible. Staff have been allowed some vacation leave in areas, and they are making internal arrangements to accommodate some more. Again, common throughout the RHAs. Weekly psychological sessions offered to staff in addition to regular EAP services. What is the EAP services? Employee assistance programs. Meals provided for staff again. 12-hour shifts at COVID units again, which provides more consecutive days off. At the Eastern, similar staff rotations, psychological support by the EAP provider, recruiting more staff to support um, the RNs and so on. Again, meals provided. Um, they try to bring some cheer with a Christmas features as far as possible. Actually, Eastern is going to have an evening of excellence quality awards to honor staff for their excellent work and commitment. So you have to recognize and reward. Virtual meetings with their units and teams to ask about their welfare and assure support. So this is what all the 4 RHAs have been doing because we are concerned. However, however, all of this, we need the public to work with us by getting vaccinated and doing the 3 Ws so that we could ease the actual physical pressure on them by not having you admitted into the hospital. So I hope this answers your question. This is what I, as Minister of Health, have been doing and insisting being done to ease the burden on our healthcare workers as far as humanly possible. Thank you very much.
Thank you very much, Minister. Let's go now to Newsday for questions, please.
Good day, Janelle D'Souza from Newsday. Two questions. Are we getting to the point where we have to pause elective surgeries and clinics and so forth? And if not, when? And the second one, have there been increasing cases in healthcare workers so as to affect their performance?
Yeah, sure. Sure. So, in terms of the elective surgeries, throughout the pandemic, what we have been trying to do is manage two systems at the same time. So unfortunately, we don't have two separate streams of staff. So the staff tend to go, as Minister would have said in some of his answers to the last question, between both services. So we have tried our best to maintain the existing elective surgeries as best as we can, together with the elective clinic appointments. And we have used telemedicine services in some of the RHs extensively to avoid people having situations where they don't have medications, for example, and that they can have a consult on the phone without actually coming into the system. So it's a juggling act, maintaining both systems at the same time. It depends on the burden that we have in the parallel system. As again, it's one staff to run both systems, so there will be a movement between both systems at any point in time, and we are trying to maintain the balance and continue the elective work together with maintaining the parallel system as best as we can. It all depends on the load in the parallel system, and if we can get that load back down again, of course, it will redound to increasing in elective surgeries as well, and in other elective procedures as we go forward. So that's where we want to get to. So parallel, yes, but the same staff servicing both. So we need to really decrease the load on the parallel system and get some increased outputs from the other systems as well. That was a second question, if I remember right.
Healthcare workers.
Health
If
in
there's
terms
an
of
increase,
COVID.
any
right.
case
So
yeah.
so throughout the epidemic, we have noted healthcare workers are part and parcel of the country. They're not separate and apart. What we have been doing though, within the clinical settings, we haven't seen a large number of cases coming out of the clinical settings, and it has been due to the fact that we have continued to have a supply of PPE. We continue to have the infection prevention control training going on throughout the pandemic and even before. So staff know how to use their PPE, they know when to use it. A lot of the times when our staff get infected, they get infected outside of the workplace. When you drop your guard at home, with family and friends, and that's what we see in our system as well. When you have a high viral load like we do now in the country, people tend to get infected anywhere. So where they have their PPE on, especially in the COVID sites, you find we hardly have any infections of persons stationed in the COVID hospitals. They use quite a lot of PPE and their guard is completely up. When they go home, though, it's a different matter. So we're asking everyone to again abide by all the 3 Ws and vaccinate as soon as they can.
Thank you very much, CMO. And now we go to Express newspaper, please.
Good morning, Camille Hunt, Express. I have a couple of questions from our sports department. They'd like
Okay,
to get
just
an
two
update
questions,
on-
please. Just two at this point,
Yes.
please. Right.
Yes, I said a couple. Our sports department would like to get an update on the under-19 Cricket World Cup games. Any updates on how that will go forward, given the travel and other restrictions? And also, will fans be allowed inside the venues to view the games? Because we've seen Antigua announce that fans will be allowed if they are fully vaccinated. So will we be taking a similar approach?
Thank you. So I think both those questions should be more properly directed to the organizers of these events. We stand committed to working with them on employing and ensuring the necessary protocols are in place. But I think really we should be directing those questions to the organizers, um, and to the organizing bodies that manage these events. But we are always part and parcel of the conversation to provide guidance and advice.
Thank you very much, Minister. Let's take a follow-up question from AZP News, please.
Good morning again. Minister, I'd ask how you feeling because I do detect a sniffle from you this morning. So is there any cause for you to take a PCR test? One question. I have another one, CMO. I'll ask that for now.
Say that again, Prior. What?
I detect a sniffle from you this morning. A sniffle like as if you had a cold. So I just wanted to know if there's any cause for you to you may need to take a PCR test.
I have no cold, Prior. I don't have the flu. I don't know where that suggestion comes from, but I thank you for looking after my health.
Not a problem.
All right. Thanks,
Can I
Prior.
ask more questions?
No, so there's no need for me to take a PCR test. I have no flu-like symptoms. I was tested when you come into TTT. You have to take your temperature. You have to sanitize. I mean, when you go into the ministry yesterday, you have to take your temperature. You have to sanitize. So thank you for your concern.
Sure.
Okay,
My question is
thank you.
CMO.
Okay, go ahead. Please go ahead.
So, CMO, the Omicron variant, right? It is more transmissible, and but it's mild. Could it be a blessing in disguise in that if people get it, they'll recover and then they'll build immunity to the and would that be to the to this variant, or you think it'll be to the all of the COVID-19? I mean, could it be that this will work towards more uh, more immunity if you get the Omicron and a smile like that? Thank you.
Okay, so the two things, just to correct the statements that you made, Omicron, it is not known as yet um, whether it will be mild or not. Actually, new data suggests that it's causing severe illnesses in the under 5 and the over 60. And that is very recent data from yesterday. So in terms of transmissibility, again, um, it is said to be more transmissible, but the data will say, once you're able to retrospectively look at the data worldwide, in the coming weeks or days, people will begin to know more about that particular variant. It's a brand new variant, just as if you remember back when Delta came out of India, the characteristics weren't well described until a couple of weeks after it had been detected and spread to different countries. So I think we have to treat it as a matter of serious concern, just as we did for Delta. And the population needs to be on their guard and vaccinate as quickly as we can to get to the point that this country has an increased amount of protection by way of immunity from vaccination, and not rely on any other type of immunity by way of a natural infection to get us where we need to go.
Thank you very much, CMO. Let's get questions now from TV6, please.
Hi, good morning. Alicia Boucher from TV6. Good morning to the entire panel. My questions this morning are for Dr. Parasram. Dr. Parasram, you gave us the time frame for Pfizer and AstraZeneca, and I was wondering if you can give us the time frame for Sinopharm in terms of the waning immunity over time, how long that takes, and when those boosters are due. And as well as what happens if, there are people in the country who would have come in from foreign territories, took Moderna while they were abroad, and are now residing here and would have to receive a booster shot. Would they, what vaccine would they be eligible to take? So that's my first two questions. I do have one more after.
Okay, sure. Thank you. So just to go over some timeframes, and this is preliminary timeframes based on the data around the world. It is subject to change. I think the SAGE group meets on Tuesday next week, so they will look at all the data and they will give us an interim recommendation as to what the interval should be. So what we have so far, AstraZeneca looks like about 6 to 7 months after the second dose. Sinopharm, same sort of time period. We're looking at about 6 months after their last dose. Johnson & Johnson, 2 months after your first dose. And Pfizer, 6 months after your last dose. Again, this is subject to change, right? So we'll wait until early next week, and then we should have some determination as to what is the final outcome. As it relates to your Moderna, so persons having Moderna, I think the safest combination with Moderna, that we don't have Moderna in Trinidad, as you know. So there's another mRNA vaccine, which is Pfizer, that we have in stock, which can be used as well. But again, there's not a lot of data aside from Canada itself, where you have combinations of Moderna and Pfizer in terms of safety and efficacy. So we would advise mRNA platforms to be followed with an mRNA for now.
Thank you very much. Let's go to AZP News at this time. I think there's another question to come from AZP News, please.
Yes. Good morning again, ministers. Are we going to look to procure more vaccines now, and which brands are we looking at? Because we have no more AZ, and AZ mix could be AZ Pfizer.
Yeah. Thanks, Prior. Yes, so we are always in talks with the vaccine manufacturers bilaterally. We are always in talks via my colleague, Minister, the Honorable Amory Brown, in talks diplomatically. And we are the ministry are always in talks with COVAX. So we always pursue those 3 lines of inquiry into what vaccines available and the quantities and so on. So the answer is yes. And as of right now, Trinidad and Tobago has about 600, let me see if I could get the exact figure. I think it's about CMO 690,000, 673,000 doses of vaccines on hand, which is a good place to be, especially as we are going to be launching the booster program. I hope to announce it later on next week, sticking to my original 2 week, 1 to 2 week deadline to get it done. Um, so those 600,000 odd persons who are already vaccinated, we will be advising you as to how you will be getting your booster to give you that additional level of support. And again, I really, really am appreciative of those persons who are coming in to be vaccinated. Um, yeah, so that answers your question prior. Candice, if you would permit me, I just want to clarify and respond to a question that was asked of the Honorable Prime Minister yesterday about Tobago's ICU capacity. Of course, the Honorable Prime Minister may not have had these details, and he more or less said so. So at Tobago, Tobago started off their ICU capacity at the start of the pandemic with maybe a handful. We increased it. Right now, they have 9 ICU beds. No, 9 and 1, 10 ICU beds. And Dr. Richards told me this morning, of those 10 beds, 7 are currently occupied. And we have been working with the Tobago Regional Health Authority and UDCOT, with the Ministry of Health coordinating under the Emergency Operations Center control, that 6 more ICUs will be operational gradually over the next week or so. So today is the 4th or 5th?
Today is the
4th.
4th.
Yes. So by the middle of December, they are actually turning over the beds, the ICU beds, I am told by UDCOT tomorrow, and that by the middle of December, another 6 ICU beds will be operational. So right now, Tobago is not using all their ICU capacity, thank God, but we are planning. You always plan for the worst and hope for the best. In addition to that, Tobago received 30 oxygen concentrators to make sure that their oxygen supply for medium to low flow oxygen patients are in fact operationalized, and they have received 30 oxygen concentrators. We also sent across more testing kits to them yesterday. We insisted that they get more because we want to make sure that they have capacity on the island to test and to treat. So that is what the current situation in Tobago is. Also, the Prime Minister was asked about staffing in conjunction with my colleague, the Honorable Tracy Davison Celestin. She did request additional ICU nurses. They requested 3 or 4. They were sent. Also, we included TRHA in the advanced training for ICU nurses, which the Prime Minister alluded to yesterday. So he will have the bigger picture and I will give you the details. So as we stand now, Tobago has 10 ICU beds, 7 occupied, 6 more to be rolled out starting tomorrow and to be fully operationalized by the middle of December. And 30 oxygen concentrators have recently gone across to Tobago, in addition to more testing capacity with the Gene Expert test kits. So Tobago is well taken care of. Thank you very much.
Thank you, Minister. And we go back to TV6 because I believe Ms. Boucher indicated she had an additional question.
Yes, thank you so much. My question is for Dr. Parasram. Because of the severity of the Delta variant, there may be persons, especially those who are pro-vaxxers, who at this time might be seeking out a booster shot through whatever links they may have in the system and so on. So I just wanted to find out, are there any dangers in taking a booster shot before the time that it is due?
Well, the reason that we have time frames for everything is one, for the efficacy of it, and but most importantly, to determine when it's safe to be taken. So when we set guidelines coming out of the regulatory bodies from around the world, they look at the safety and efficacy based on different times. For example, if you take an example for AstraZeneca, they would have done studies to see what the antibody titers would have been at 1 month, 2 months, 3 months, etc., going down the line post your second dose, and determine when you would begin to see that fall in vaccine in antibody level to recognize when you need to have a booster. What would have been done as well is looking at the dosing schedule for the particular boosters, whether it needs to be a full dose, a half dose, or thereabouts, and when the safety of it is important to know when you're going to take it as well. So the safety, both for the safety and efficacy, the guidelines are set for that reason, and we are asking everyone to abide by the guidelines. If you go outside of it, certainly you can be compromising both safety and efficacy. So try your best to keep with the guidelines that we set. And at the Ministry of Health sites, we abide by the guidelines across the board.
Thank you very much, CMO. We don't seem to have any additional questions from the media, but I'll just give them 1 minute in case any of them do. And in the interim, I will just remind the population that if you feel so moved as to go and be vaccinated, you can do so now up until 3 o'clock. We have locations north, east, central, and south that are open as we speak. In the north, at the Paddock Queen's Park Savannah, today 9 to 3 and tomorrow 9 to 12 noon. Courts Megastore, we partnered with Courts in Sawa from 9 to 5 p.m. today and tomorrow. In the east, Costat El Dorado, Wallerfield International Raceway, and Larry Gomes Stadium. Today 8 to 3, tomorrow 8 to 3 as well. In central Trinidad, UTT Chaguanas campus, today at 8 to 3. Courts Freeport, today and tomorrow 9 to 4 p.m. And in South Trinidad, at Sapa today 8 to 3 and Sunday 8 to 12 noon, or Court South Park San Fernando today at 9 to 3 or tomorrow at 9 to 3. And just note that all of this information is available on social media and also available on the Ministry of Health's website. So if you want to go, you still have time to go get vaccinated right now. And so I see we have a follow-up question from Newsday, please.
Hi again. Yesterday there were a few reports of motorcade with Angostura trucks and music and women in glass cases on Arapita Avenue. And we're wondering if the ministry has any concerns about that kind of messaging during this third wave of a pandemic, alcohol and climbing and partying.
Yeah, so I will take that question. So I'm not aware of what you were speaking about. However, there is something called the Public Health Regulations, which is a document which I have here. We just ask all persons, whether it's corporate, whether it's individual groups, because in addition to that, which I didn't see, but what I did see was what happened in the savannah on Tuesday or Wednesday. It's very, very disconcerting. So any type of gathering, um, even in your homes, any type of gathering at this point in time is something we should think twice or three times about, whether it's a protest, as we saw in the savannah, with people encouraging their little children not to wear masks. I am just hoping that that gathering in the savannah does not result in a spike, because what you saw there were people shouting, people without masks, people uh, behaving in a particular way. So let us all, at this point in time, think twice um, before gathering in dangerous situations. As you said, you had people in a glass case, they may have been isolated, but however, don't give the police work that all of us are overworked. Police, healthcare workers, all of us are overworked. And as the Honorable Prime Minister said yesterday, you can't put a policeman on every door, on every corner. And what is called for now is so much societal and personal responsibility to manage this current surge. And at Christmas time coming up, because I get people writing to me on a daily basis to have weddings with 100 people, birthday parties in public places. Now, I'm glad you raised it because I, as Minister of Health, have no authority under the way the current public health regulations are worded to grant any waiver for any public gathering. So I would appreciate if people don't write to me. I have no latitude, I have no discretion to grant any gathering in any public place for over 10 persons. Whether you want to have a wedding, whether you want to have a birthday party in a community center, I have no discretion. At this point in time, and I really do appreciate the questions this morning about that and for raising it. We have to be careful. We have to be vigilant. We have to be vigilant and be our brother's keeper. Thank you for raising the issue.
Thank you, Minister. Let's go back to TV6, please.
Hi, good morning again, Alicia Boucher. My question this time is for Minister. Minister, I know we did put some travel restrictions on a few African countries, and I was wondering, given that Omicron is now in 28 countries, and Dr. Parasram did say, there are 1 or 2 cases in certain countries, but I was wondering if we are looking at any other countries for the purpose of travel bans.
Thank you very much, Alicia. Very topical issue. So we always monitor what is happening around the world. But you would realize that the posture of governments around the world now, as opposed to a year ago, is to impose restrictions, whether it's travel restrictions or lockdowns or state of emergencies, is being tempered a little bit now by considering the whole societal picture, the need for the economy to be open, the need to save not only lives, which was a earlier priority, but now lives and livelihoods. So your question is a very valid one. It is something we continually look at. It's something that we evaluate, and as soon as a decision is made, the public will be informed. Thank you very much.
Thank you, Minister, and everyone for participating. We have come to the end of today's media conference. Everyone, please remember to wear your mask when in public, watch your distance, and wash or sanitize your hands. And of course, please get vaccinated. Everyone, be safe and have a good day.
My name is Naraya.